This presentation, Three Paths to Altered Minds, examines how psilocybin, LSD, and cannabis are used within modern research as potential therapeutic tools for mental health. By comparing these substances across experimental findings, I aim to identify their shared neurobiological mechanisms, treatment outcomes, and limitations in current research. The goal is to integrate evidence from multiple studies to clarify how these psychoactive compounds may influence depression, anxiety, PTSD, and other mental disorder symptom reduction. This study focuses again on psychoactive substances, specifically LSD, psilocybin, and cannabis, and their emerging role in mental health treatment. Each have shown potential for reducing symptoms and disorders such as depression, anxiety, and PTSD. While prior research has been promising, most findings remain fragmented. This review seeks to synthesize those results and highlight consistent biological mechanisms, therapeutic outcomes, and the need for rigorous comparative analysis across substances. This slide summarizes findings from Griffiths et al. 2016, which reported pronounced reduction in depression and anxiety symptoms among patients with life threatening cancer diagnoses following a psilocybin assisted therapy. Results across multiple inventories, including the Hamilton Depression and Anxiety Scales and the Beck Depression Inventory, demonstrate both rapid and sustained improvements. These findings underscore psilocybin's capacity to enhance emotional well being, promote acceptance of death, and reduce existential distress through transient yet profound alterations in consciousness. Recent studies, including Holtz et al. 2024, demonstrate that LSD assisted psychotherapy leads to statistically significant reductions in anxiety symptoms compared with a placebo. The data shown here highlights consistent decreases across standardized anxiety scales and multiple follow up periods, or over multiple follow up periods. LSD appears to facilitate emotional processing and disrupt maladaptive cognitive patterns through serotonergic 5-HT2A receptor activation, supporting its potential as a controlled adjunct to psychotherapy for resistant anxiety disorders, anxiety in general, or not shown in this study, but could also serve as a co-administered medication or substance for treatment-resistant depression. This slide focuses on the role of CBD in modulating neural activity. CBD functions as a partial agonist of the serotonin 5-HT1A receptor, which contributes to its anti-anxiety and antidepressant effects, according to Ortiz et al. 2022. The diagram illustrates spatial overlap between cannabinoid and serotonin receptors within key brain regions such as the prefrontal cortex, hippocampus, and the amygdala, indicating a neurobiological basis for mood regulation and potential therapeutic synergy between endocannabinoids and serotonergic signaling. The purpose of this project, as said before, is to summarize and evaluate evidence supporting psychoactive assisted therapy for mental health disorders. This rationale, sorry, this rationale stems from the limited and often isolated nature of existing studies, which focus mainly on a single compound without integrating broader findings. The guiding hypothesis is that LSD and psilocybin and cannabis each produce measurable reductions in mental health or in mental disorder symptoms, supporting further clinical exploration and comparative meta analyses across the psychoactive classes. Uh, for this synthesis, the inclusion criteria focused on adult populations diagnosed with depression, anxiety, treatment resistant disorders such as treatment resistant depression, uh, PTSD also is included. Articles that were published between the years 2015 and 2025 giving a 10-year period were reviewed, restricted to English being the publication language for consistency of interpretation. Um, Most of these studies, if not all that have been found, uh, had a small sample size. Most of the time, 50 to 51 participants maximum, which in turn reflect both the ethical limitations and funding constraints in psychoactive research. Exclusion criteria included non-clinical populations and studies without explicit safety or outcome data. Other eligibility criteria were if the study had included, as said, if it included the physiological um, effects as well, those were also included in possible reference material. For the measures, the human trials for the psychoactive research most commonly use validated scales to quantify symptom changes in depression and anxiety. For example, these key instruments include the Montgomery-Åsberg Depression Rating Scale, or the MADRS, the Hamilton Depression Rating Scale, the HAM-D-17, as it's a 17-item rating scale, the Generalized Anxiety Disorder 7-item, the GAD-7, and the Patient Health Questionnaire, so the PHQ-9. These tools allow cross-study comparisons and provide reliable measurements for evaluating treatment efficacy across different psychoactive interventions. And then for source selection, sources were located primarily through Google Scholar, wherein I was able to follow through with PsycInfo or PubMed or international English language papers, which allowed a capture of cross-cultural research context. For keywords, this is not an extensive list, but uh, LSD, psilocybin, cannabis, and psychedelic assisted therapy, depression, anxiety, PTSD, post traumatic stress disorder, etc. To further refine the search, Boolean operators were implemented. Boolean operators such as and, not, and for, uh, to eliminate irrelevant studies, which ensured a comprehensive coverage of recent findings while maintaining relevance to the psychoactive treatments themselves. In order through the selection process, first abstracts would be screened for relevance and alignment with this study's focus on psychoactive assisted therapy. Eligible studies were then organized into Zotero for reference management, Zotero being a reference managing system, with each paper being then put into a nested folder for each compound type. Data extracted from these papers are or included the author, the year, the sample size, if applicable to the paper, the outcomes, the design type, as well as physiological side effects to further assess the safety criteria or the safety application of these substances. This methodolo- oh, this uh, organization ensured traceability and consistency during the synthesis and comparison phases. Again, key variables that were extracted from the studies again include the sample size, the intervention type, primary outcomes measured, the effect size, and confidence intervals. As well as I had said, the adverse effects or physiological effects were also noted to assess safety profiles. Results are then to be summarized through a narrative synthesis for qualitative themes and via tables and figures to illustrate quantitative outcomes. This dual approach will allow both statistical and conceptual integrations of the findings. For the planned analysis, the analyses included the descriptive summaries, the weighted means and p-value significance testing to compare symptom reduction from baseline and placebo conditions, as well as taking advantage of post hoc tests that are used in these studies to examine further pairwise differences. Um, Going with these data types, the expected patterns um, suggest LSD and psilocybin produce consistent symptom improvement, while cannabis or cannabinoids results are more variable or null, such as reported by Bond Miller et al. 2021, where they ran a placebo versus inhaled cannabis in veterans with PTSD to see if there was any significant reduction in PTSD symptoms. They had stated that they were the first to do this type of experiment and that it was a failure, not due to there being no significant effect from the cannabis, but there was no significant difference between the cannabis and the placebo. Although there were significant reductions in PTSD symptoms, there was no significant differentiation between cannabis and placebo. They had attributed that failure to potential bias in participants who had been chronic cannabis users. But they did state that it does raise interest for further studies. The main goal of the analysis is to identify compound specific and shared therapeutic mechanisms, such as the LSD and psilocybin both share the activation of the serotonin pathways, the 5-HT2A receptors. In terms of expected findings, it is anticipated that compounds will demonstrate measurable, rapid, and sustained symptom reduction in depression and anxiety, for example. Findings may also reveal shared neurobiological pathways, particularly, as I was saying, those involving the 5-HT2A and 5-HT1A receptor modulation, such as seen in for the 5-HT2A, the LSD and psilocybin. However, results also highlight the need for larger, longer term trials to validate these effects and to support clinical and policy applications of psychedelic assisted therapies. The need for larger sample sizes is definitely a need, as well as having a longer term interval, such as a longer time where participants are following through and going to assisted therapies in clinical settings, or a longer follow up window of time. For implications, this review holds value across academic, clinical, policy, and public health domains. Academically, it can integrate disparate clinical findings to advance scholarly understandings by bringing together these three substances into one paper instead of being skewed about by individual substance. Clinically, it supports expanded research in treatment resistant populations such as treatment resistant depression or treatment resistant anxiety, so on and so forth. Policy wise, data may inform regulations, licensing standards, and therapist training requirements. If psychoactive assisted therapy becomes mainstream, there would need be additional training to better understand dosage, how to establish a safe participating space due to the common effect of or common turn down of people being worried that they're going to have a bad trip or they're going to have a bad experience when in reality that space needs to be established before